Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
When a newborn does not contract HIV, even though one or both parents have the virus, it's typically due to effective prevention methods implemented during pregnancy, labor, delivery, and postnatal care. Here's how this can happen. Prenatal care and medication. During pregnancy, individuals who are HIV positive receive specialized prenatal care to ensure the health and well-being of both the mother and the developing fetus. One of the key components of this care is the administration of antiretroviral therapy, ART, which consists of a combination of medications specifically designed to combat the human immunodeficiency virus, HIV. These medications work by targeting different stages of the HIV life cycle, ultimately reducing the viral load in the bloodstream. The primary goal of ART during pregnancy is to achieve viral suppression, which means reducing the amount of HIV in the mother's blood to undetectable levels. When the viral load is suppressed, the risk of HIV transmission to the fetus is significantly reduced. This is because a lower viral load decreases the likelihood of the virus crossing the placenta and infecting the fetus during pregnancy. Additionally, ART helps improve the overall health of the mother by strengthening her immune system and reducing the risk of opportunistic infections associated with HIV. By maintaining good health during pregnancy, the mother is better able to support the growth and development of the fetus. Prenatal care for HIV-positive individuals also involves regular monitoring of viral load levels and adjustment of medication as needed to ensure optimal viral suppression. Healthcare providers closely monitor the mother's health and the progression of her pregnancy, addressing any concerns or complications that may arise. Overall, prenatal care and medication play a critical role in preventing mother-to-child transmission of HIV by reducing the viral load in the mother's bloodstream and minimizing the risk of transmission to the fetus during pregnancy. Preventing transmission during labor and delivery. The risk of HIV transmission to the newborn can increase during labor and delivery, especially if the mother's viral load is not well controlled. To minimize this risk, healthcare providers take specific precautions and follow established protocols to prevent transmission during the birthing process. In cases where the mother's viral load is high or not well controlled, healthcare providers may recommend a cesarean section, C-section delivery instead of vaginal delivery. A C-section reduces the amount of time the newborn is exposed to the mother's bodily fluids, including blood and vaginal secretions which may contain the virus. By minimizing exposure during delivery, the risk of HIV transmission to the newborn is further reduced. Additionally, healthcare providers may administer intravenous, IV, antiretroviral medication to the mother during labor and delivery to provide additional protection to the newborn. This medication helps further reduce the viral load in the mother's bloodstream and decreases the risk of transmission during the birthing process. During labor and delivery, healthcare providers also take precautions to minimize the risk of accidental exposure to the newborn's mucous membranes, such as the eyes, nose, and mouth, which can potentially come into contact with the mother's bodily fluids. This may involve using protective equipment such as gloves, gowns, and face shields, as well as carefully monitoring the birthing process to prevent any accidental exposures. By following established protocols and taking appropriate precautions during labor and delivery, healthcare providers can significantly reduce the risk of mother-to-child transmission of HIV and ensure the safety and well-being of both the mother and the newborn. Postnatal care and medication. After birth, newborns born to HIV-positive mothers receive specialized postnatal care and medication to further reduce the risk of HIV transmission and promote their health and well-being. This typically involves administering prophylactic antiretroviral medication to the newborn for a certain period, depending on the specific guidelines of the healthcare provider or health organization. The purpose of postnatal antiretroviral medication is to provide additional protection to the newborn and reduce the risk of HIV transmission during the postnatal period. This medication helps inhibit the replication of any remaining HIV particles that may have been transmitted during labor and delivery or through breastfeeding, further reducing the likelihood of infection. The specific type and duration of postnatal antiretroviral medication may vary depending on factors such as the mother's viral load, the infant's health status, and local treatment guidelines. Healthcare providers closely monitor the newborn's health and response to medication, adjusting the treatment plan as needed to ensure optimal protection. In addition to medication, newborns born to HIV-positive mothers receive comprehensive postnatal care, including regular monitoring of vital signs, growth and development assessments, and screening for HIV infection. Early detection of HIV infection allows for prompt initiation of treatment, which can improve outcomes and reduce the risk of complications associated with untreated HIV infection. Along with medication and monitoring, newborns born to HIV-positive mothers may also receive supportive care and counseling to address any concerns or challenges that may arise. This may include guidance on infant feeding practices, nutrition, and general care to promote the health and well-being of the newborn and support the mother-infant bond. Overall, postnatal care and medication play a crucial role in preventing mother-to-child transmission of HIV by providing additional protection to the newborn during the postnatal period and ensuring early detection and treatment of HIV infection if present. Avoiding breastfeeding. While breastfeeding provides numerous benefits to newborns, it is not recommended for infants born to HIV-positive mothers due to the risk of HIV transmission through breast milk. HIV can be present in breast milk, and breastfeeding poses a significant risk of transmitting the virus from the mother to the infant. To prevent HIV transmission through breastfeeding, healthcare providers advise HIV-positive mothers to avoid breastfeeding and instead opt for alternative feeding methods, such as formula feeding or donor milk. This eliminates the risk of HIV transmission through breast milk and ensures the safety and well-being of the newborn. Healthcare providers provide guidance and support to HIV-positive mothers to help them make informed decisions about infant feeding practices. This may involve counseling on the risks and benefits of breastfeeding versus formula feeding, as well as practical advice on preparing and feeding formula to the newborn. In addition to avoiding breastfeeding, HIV-positive mothers may also receive support and resources to address any challenges or concerns they may have about infant feeding. This may include access to formula milk, feeding supplies, and information on safe preparation and storage of formula. By avoiding breastfeeding and opting for alternative feeding methods, HIV-positive mothers can effectively reduce the risk of mother-to-child transmission of HIV and ensure the health and well-being of their newborns. Regular monitoring and testing. Newborns born to HIV-positive mothers undergo regular monitoring and testing for HIV infection in the weeks and months following birth to detect any potential transmission early and initiate appropriate treatment if necessary. The timing and frequency of testing may vary depending on local guidelines and protocols, but it typically involves performing HIV tests at specific intervals, such as within the first few days of life, at 1 month and again at 3 months of age. Early testing allows for prompt detection of HIV infection and timely initiation of treatment if needed. HIV testing in newborns may involve different methods, including nucleic acid tests, NAT, enzyme-linked immunosorbent assays, ELISA, and polymerase chain reaction, PCR tests, which are highly sensitive and specific for detecting HIV infection in infants. In addition to HIV testing, newborns born to HIV-positive mothers also undergo regular monitoring of their health and development, including assessments of growth, vital signs, and immunizations. This helps healthcare providers ensure the overall well-being of the newborn and identify any potential health concerns or developmental delays early. If HIV infection is detected in a newborn, healthcare providers initiate appropriate treatment and care as soon as possible to manage the infection and prevent complications associated with untreated HIV. This may involve administering antiretroviral medication and providing supportive care to address the infant's specific needs. By undergoing regular monitoring and testing, newborns born to HIV-positive mothers can receive timely detection and treatment of HIV infection if present, reducing the risk of complications and improving long-term outcomes. Ensuring maternal viral suppression. Maintaining viral suppression in HIV-positive mothers is critical for preventing mother-to-child transmission of HIV and promoting the health and well-being of both the mother and the newborn. Viral suppression refers to reducing the amount of HIV in the bloodstream to undetectable levels through consistent use of antiretroviral therapy, ART. When the viral load is suppressed, the risk of HIV transmission to the newborn is significantly reduced, as there are fewer HIV particles present in the mother's blood to potentially infect the fetus during pregnancy or the newborn during labor and delivery. Achieving and maintaining viral suppression requires adherence to ART, which involves taking medications as prescribed by healthcare providers and following recommended treatment regimens. Healthcare providers closely monitor the mother's viral load levels throughout pregnancy and adjust medication as needed to ensure optimal viral suppression. In addition to ART, HIV-positive mothers may receive comprehensive prenatal care and support to address any challenges or barriers to adherence, such as medication side effects, stigma, or psychosocial issues. This may involve counseling, education, and access to resources to help mothers understand the importance of viral suppression and overcome any obstacles to treatment adherence. By ensuring maternal viral suppression, healthcare providers can effectively reduce the risk of mother-to-child transmission of HIV and promote the health and well-being of both the mother and the newborn. Proper implementation of prevention strategies. The prevention of mother-to-child transmission of HIV requires a multidisciplinary approach involving healthcare providers, public health officials, policymakers, and community organizations. Proper implementation of prevention strategies is essential to reduce the risk of HIV transmission and ensure the health and well-being of both the mother and the newborn. Key components of prevention strategies include prenatal care, medication adherence, labor and delivery protocols, postnatal care, and infant feeding practices. Healthcare providers play a central role in coordinating and implementing these strategies, working closely with mothers to provide comprehensive care and support throughout pregnancy, labor, delivery, and the postnatal period. Prenatal care for HIV-positive mothers involves regular monitoring of viral load levels, adjustment of medication as needed, and counseling on the importance of adherence to ART. Healthcare providers also take specific precautions during labor and delivery to minimize the risk of HIV transmission to the newborn, such as recommending cesarean section delivery for mothers with high viral loads. After birth, newborns born to HIV-positive mothers receive specialized postnatal care, including prophylactic antiretroviral medication, regular monitoring and testing for HIV infection, and guidance on alternative feeding methods to prevent transmission through breastfeeding. In addition to clinical care, prevention strategies may also involve education, outreach, and community engagement to raise awareness about HIV prevention, reduce stigma, and promote testing and treatment services. This may include initiatives such as HIV testing campaigns, educational workshops, and peer support groups for HIV-positive mothers and their families. By implementing comprehensive prevention strategies, healthcare providers and public health officials can effectively reduce the risk of mother-to-child transmission of HIV and improve outcomes for HIV-positive mothers and their newborns.